And on August 12th, as folks know, I announced a COVID-19 vaccination or regular testing mandate for city workers. This policy requires that all City of Boston employees, contractors, and volunteers provide proof of vaccination or a negative test result. The first phase of implementation began on September 20th with public-facing workers who interact with high-priority residents like our children and seniors. 2 additional phases will continue through October 18th. As the city's largest employer, the City of Boston is leading by example to ensure our workforce is vaccinated or regularly tested. We are working closely with our diverse workforce, our union partners, and our department heads to ensure employees have access to vaccination, testing, and verification systems to achieve full compliance with the mandate. These measures include online verification portal, a technical assistance hotline, language translation services, and walk-in locations that are available for BPS staff or others who may have limited access to technology. As of yesterday, September 29th, 13,332 city employees have verified their vaccination status or negative COVID-19 test results. HR staff and contractors are currently processing hundreds of additional submissions to complete verification of the employees included in Phase 1. Employees experiencing difficulty with uploading their verification status or those who have questions about their Access Boston account should visit the Access Boston portal help at boston.gov. Employees can also contact our Department of Innovation and Technology, or DO-IT, at 617-635-7378. We want to make sure that every employee gets the support they need to verify their vaccination status. Our goal is to vaccinate as many City of Boston workers as possible because we know the vaccine is the best tool to protect ourselves and those we love. Our public health approach to the vaccine rollout has helped to make Boston one of the most highly vaccinated big cities in the country. As we continue efforts to vaccinate all eligible Boston residents, we are also building equitable access to new vaccine boosters. The Centers for Disease Control has issued eligibility requirements for the Pfizer vaccine booster shot, which include people 65 years and older, residents in long-term care settings, people aged 18 to 64 years with underlying medical conditions, and people aged 18 to 64 who are at increased risk for COVID-19 exposure and transmission because of their occupational or institutional setting. As a city, we are committed to ensuring that all residents who are eligible for boosters have equitable access. Our vaccine booster plan includes estimating the number of Pfizer recipients who are eligible for booster shots, mapping access points to the vaccine by neighborhood, determining vaccine capacity and supply, and identifying gaps by location and collaborating with trusted clinical partners to fill those gaps. We will continue to emphasize reaching the unvaccinated and those who require second doses through a comprehensive health communications plan that encourages getting tested, getting vaccinated, and staying safe from the virus. It is important to remember that our unvaccinated population includes young children who are not yet eligible for vaccines. We are carefully monitoring the development of vaccines for children ages 5 to 11. And while approved shots may not be available until November, we have begun COVID-19 vaccine access planning for Boston's youngest residents. In terms of our current COVID data, the citywide positivity rate for COVID-19 is 3%. This is down by 1.1% over the last week and places us firmly below our threshold of 5%. Hospitalizations rose over the past week from 116 to 125. This increase is mostly among unvaccinated residents and remains below our thresholds of concern on each of the public health COVID metrics. As of Tuesday, September 21st, 72% of Boston residents have received at least one shot of the vaccine, and nearly 65% of residents are fully vaccinated. As we continue with our vaccination efforts, we must also continue getting tested. Anyone who shows symptoms or has traveled or who has been exposed to the virus should get tested. Testing helps us to understand the spread of COVID-19 in our city, and it also helps us to slow the spread. We will continue monitoring data from the Boston Public Health Commission, following the advice of public health experts and centering the science. I encourage anyone who has not yet received their vaccine to do so. I also encourage people to continue to get tested and to remind everyone of the indoor mask mandate. Let's continue to take the steps necessary to keep our city safe and protected. Thank you. Are there any questions?
The U.S. Supreme Court said that they would take up a case against the city of Boston from the previous administration, where it proved that the work applied flag was not.
Well, as you mentioned, this is a very old case. I certainly respect the courts and await next steps. Yes.
Emergency meeting this morning regarding relocation to the hotel area, and they said they were blindsided by it. Nobody from this office has said they heard from the city of Boston. One of the selectmen said, quote, "It's a lame duck effort by the mayor trying to make a name for herself and get some authority." Just your reaction to
this crisis continues to be left on the shoulders of Boston when other municipalities and towns are not doing all that they can. I am encouraged by the work that is underway. The City of Boston has been in close communication with officials at the state, with the District Attorney's Office, with the courts, and with other municipalities to find solutions to this crisis. What I will not do is engage in a finger-pointing campaign, one that is about pointing blame and not finding solutions. Meanwhile, the residents that are here in our city, and we know that more than 60% originate from other towns, they are here in the city of Boston, and as long as they are, we will continue to step up with a public health strategy that ensures that we can refer people to treatment and to housing to get them off the streets. I don't think it is helpful to go back and forth pointing fingers. What I am looking for is solutions, and anyone who wants to be part of that conversation, we welcome them. I can't hear what you're saying.
their issue is they haven't heard from the city of Boston and all. They hear it through the media. They just found out Monday.
I don't know who they are.
Board of Selectmen in Saugus.
So, again, here in the city of Boston, we have a public health strategy that is meeting people where they are, referring people to treatment, reversing overdoses on average 5 a day, getting people into housing as best we can. We need for every single town in the Commonwealth of Massachusetts who want to be partners in this to offer supports to residents who need that support. If they are dealing with the opioid crisis or mental health challenges or homelessness, it is important that we all do what we can. I'm not familiar with what you're talking about with the Saugus Board of Selectmen, but if they want to be part of the solution to this, I welcome them. So the City of Boston is doing what the City of Boston can here in the city. What we need, though, is a strategy across the Commonwealth that is not led by the City of Boston, that is led by the state to ensure that people who need beds have those beds, that they're low-threshold beds that they can get into, and that people who need support all across our Commonwealth can get that support. We know that addiction knows no boundary, no zip code. no town lines. We need a comprehensive strategy across the Commonwealth. That is why I am encouraged by the work that we are engaged with the state, with the DA's office, with our public safety teams here in Boston, with our public health teams here in Boston. And any other municipality who wants to join in that effort, we welcome them.
So now the city's looking at doing 2 other cities. Are the city looking at others as well?
Did you have a question? Yes. So again, the Commonwealth of Massachusetts has identified other municipalities, has invested dollars. What we need to see happen is for those low threshold beds in terms of housing to be realized so that we can have a comprehensive strategy across the Commonwealth to support all of our residents across the Commonwealth. Thank you.